A very good morning, students. Today we will start a new unit which is meeting special needs of patient. So, under this meeting special needs of patient, we will discuss meeting special needs of mentally challenged patient, and then meeting special needs of self-care abilities, and then at last we will discuss pain management. So, first of all, we will discuss meeting special needs of mentally challenged patient today. Okay, so here we will discuss about what are the cares we need to give to those mentally challenged patients. So before moving on to this topic, first of all we will know what is mean by mentally challenged patients. So we'll see the definition of mentally challenged patient. So mentally challenged are those patients who has an intellectual disability or who is perceived to have an intellectual disability, which means these are those patients whose intellectual ability is abnormal. What is mean by intellectual? Intellectual is nothing but the IQ level or the thinking ability. The ability of thinking of a person is known as intellectual. Okay, so in these kind of mentally challenged patient, their thinking ability will be abnormal, their thinking ability will be impaired. So those patients are the patients whose intellectual ability, that means whose thinking ability, will be abnormal, or who is perceived to have an intellectual disability, or uh, who are more prone to get this intellectual disability. Okay, so who are at the risk of having this intellectual disability, that means who are uh, more prone to have thinking disability. Okay, so these kind of patients are known as mentally challenged patients. So mentally challenged patients are those patients whose thinking abilities are abnormal, either whose thinking abilities are abnormal or prone to get uh, thinking abnormality. Okay, so those kind of patients are known as mentally challenged patient.